The Human Resources Committee meeting for December 5, 2019 will come to order. I don't normally have a prayer or do the flag at the committee meetings, so we'll get into the first item for approval. Do we have anybody for public comment?
Yes, sir.
Okay. We'll get into the first item, and that's the approval of minutes from November 13, 2019. So if I can have a motion to accept the minutes.
Motion to accept the minutes, sir.
Okay.
Second.
Okay. All right, all in favor, please raise your right hand. Okay, the minutes are accepted. Okay, today's meeting, there were a couple of items that we talked about being on the agenda. One of them being to talk about the pension, but we have an issue that we need to sort through the processes that are required to replace a resigning commissioner. So I limited the discussion today to just the health care plans and to talk about that. We have not received any information to tell us, what United Healthcare is going to offer us this year. We're expecting it toward the end of the month, but we need to look at our health care, and we don't really spend enough energy managing our health care dollars and our health care processes, in my opinion. It is 8% of our budget, so that's extremely important. And if you look at sets of slides that you have, you'll see that it is the second most expensive item of this organization. So we need to a little bit more aggressively manage what we do. And we're going to talk about that. The current share with the employees, if I have this correct, and Tina, or Andrew, if I've got it, but we currently, JWSC pays 90% of the health care costs for employee only, and the employee picks up 10%. The other categories for health care that we give, the employee pays 20% and JWSC pays 80%. That's correct?
In the ballpark, yes, sir.
Okay, so last year we had a lot of claims history that caused our health care to become much more expensive than it had been in prior years, and we need to look at how we can manage that. The other thing is that we want to make sure that our workforce goes to the doctor when they're sick and need care. We don't need problems festering, and so that the employee gets sicker and we wind up with higher health care to manage something that could have been managed in the early stages. So that's kind of where I'm headed on that area, and how I'd like the rest of my fellow commissioners to kind of follow in and try to meet that. The other thing, I don't think we have as good a participation in wellness visits, or correction, I guess it would be called a wellness visit, where we look at it, and we want to encourage that, and some things that we need to do to come up with incentives for the employees to do their wellness visits. So with that, I'm going to turn it over to Katina, and she's going to walk us through the preliminary renewal discussion, and then after that, Andrew's going to give us some information on health reimbursement accounts and what we could do with people that use a health savings account.
Okay, great. Thank you so much. So just following this very small 4-page packet, at the top you'll see that currently the commission offers 3 health plans. You offer a $1,500 plan, a $3,500 plan, and last year we added the health savings account plan that has a $5,000 deductible. And one of the things Commissioner Elliott was talking about in our discussion was how few participants we have on the HSA plan. We only have 5 people. we believe that that's because employees are unsure of how the HSA works, or they realize that there's a $5,000 deductible standing between them and any health care expense that's not wellness. So we hope that with additional education and discussion and maybe some new opportunities from the commission for next year, that we might be able to increase those numbers. As Commissioner Elliott talked about, ideally what we're trying to do is keep costs stable or drive them down by getting the group to be healthier. That's not always in the power of the employer because the employee has to be part of that process. But with taking steps such as incentivizing wellness, catching things early, it really does make all the difference on the back end of the claims. So again, just looking at this packet, this shows you how many participants we have on each plan. On the 1,500 plan, the richest and most expensive plan, we have 10 employees, 3 with spouse, 1 with child, 2 with family, for a total of 16 employees on that plan. The middle of the road plan, which is middle road cost, also lower and out of pocket, we have a much higher, 105 total on that plan, with 51 single, 11 with spouse, 20 with children, and 23 family. And again, of course, just the 5 on the HSA, 2 single, 1 with spouse, 1 with child, and 1 family. So any questions on the participation at all, or why employees may choose one plan over another? Because this meeting is really about you telling me what you want to see, how you want to see it for renewal. This is just a preliminary as we're moving forward and gathering information, how you want us to put that together. Mayor, did you have a question, sir?
I did, is it, the people that's on the 5,000, the HSA plan due to economic, due to financial,
It very well could be. It is the lowest cost plan, and sometimes they see the lowest cost plan and they just gravitate towards it. One of the things I can assure you of, though, is in those employee meetings, and Daphne and I were in all of them, we made it very clear you pay everything. Okay. So no one accidentally fell into that plan. We did not want that to happen because we didn't want any complaints to come up through management that it was not fully made clear that you are making a choice that you're taking on the healthcare risk. But at the same time, if I'm choosing a healthcare plan and I know I never go to the doctor and my wellness is covered at 100%, if I can save several $100s a month and not have to spend it unless I use it, it makes sense. And that's why the HSA was put in place. So employees who had that concern, that felt like, I don't really want all the bells and whistles, I just want the just in case something serious happens, and that's why we did it. Yes, sir. Any other questions? Okay, so moving on, again, renewal is March 1st. We don't have that renewal now. They don't have to send it to us until 60 days prior, but we are going to get it closer to Christmas. That'll allow us to get it out a little quicker and turn this around. We are going to have multiple meetings and discussions, so anyone that wants to be a part of that certainly can, but we have done and will continue to do a deeper dive into some of this information. So if you have any questions now or later, you can email them through Andrew, Daphne, whatever you need. The deductible report we have on pages 3 and 4. I'm sorry, not the deductible report. The deductible report we have is only for about 8 months, and it shows that we have very few, less than 10 people meeting the deductible. The reports on pages 3 and 4.
If I could interject, Katina, that's on any plan they're meeting the deductible. So there's less than 10 on any of the 3 plans total that are meeting the deductible, not on one specific plan.
And we recognize that the fourth quarter, people meeting the deductible is high. That's when people can take vacation. There's a little more time around the holidays. So it's very possible that this report 3 months from now may look very different because many more people may meet the deductible. But on average, on a group, there's around 10% or less that actually ever meet the annual deductible. So looking at pages 3 and 4, this is just general information, and it is for the full 12 months. Remember, your renewal is going to be more focused on March 1st of this year to March or the end of February for next year, except the insurance company has to cut it off 60 days prior, so it's about 15 days prior to that that they actually stop looking at claims, but they can see what's ongoing, if there's been a prior authorization for surgery, they know what those claims may look like in the future. If there are people taking medication for certain things, they'll be able to tell what those future claims may be, and that plays into account as well. But this just gives you an idea of where some of the claims are coming from. You can see that the inpatient was very high. The outpatient was also high, which means more people are getting things done outpatient and getting back home and hopefully back to health and back to work. Some of the information that's uncategorized, that could be a multitude of things, and we can talk about that if need be. But it tells you how many outpatient x-rays, labs, and the emergency room is high usage. So we will be adding an education piece to the meetings to talk about using urgent care over the emergency room. Any questions on this page at all?
I do. I don't want to wade into the swamp with a lot of details, but do we have information that segregates the cause for visiting the ER, whether it was, accident related or if it was really health related?
I can find out if we can get that.
And the reason I offer the question there is perhaps some of that can be addressed through a more aggressive wellness program. And I'll offer this. I recognize that our pool of employees is quite small. And that one or two outliers can really drive the statistics. And we probably have that no matter what our program is. But what I've seen, having been in much larger pools, the wellness program was very robust. One company I was with, we had I'll call it a health check, where caregivers came to the office, we had appointments, and they did the basic health screening. If you participated in that as an employee, then you received a small stipend for that. If you participated further with a wellness plan that had action items and milestones to meet, then your stipend was a little bit bigger than that. And that was in addition to the normal wellness visit any employee might choose to exercise on an annual basis. But one of the things it did was focus people on lifestyle changes that would improve their health.
Right.
And that was a significant focus to help manage the premium cost, if you will. And obviously, employees would benefit from that primarily. From a financial standpoint, it helped to stabilize the increase, if you would, made the curve a little bit flatter over time. So for myself and perhaps for my fellow commissioners, if we had something that could help support those kind of facts for this pool, maybe that's directionally what we need to do.
Okay.
That's good. Let me ask you a question. It's kind of, one of the things is encouraging people to get their wellness visit and then to do the other things that you just talked about. And the question I have is, have you any experience in when that was part of an individual's performance plan?
No, we did not include that as part of their performance plan. But if an employee participated in, I'll call it the wellness check, it wasn't the annual visit, if you will, with the doctor, but was the healthcare professional that came to the office. It was a private session. But they went in, they got the cholesterol, the blood pressure, the basic things checked, and which kind of put them on a watch list or gave them a good check for good behavior, if you will, from a health standpoint. And then if they went beyond that, they could talk to another professional via telephone, and that other healthcare person would know their numbers, if you will, and then would recommend certain changes and an action plan. And if they bought into the action plan and they met those milestones, then their stipend was significantly more. For example, that just to participate in the health checkup was $100, just to show up. get your finger stuck and your
Right.
blood pressure
So,
taken.
so
and,
you essentially paid them to show.
Yeah, paid on company time. And then the next one would get you the balance of $500. It'd be another $400 if you met all of your milestones in that period of time that was set. For example, it was 6 months, 10, 12 months time. And that in itself helped drive down the cost because the employees became more healthy because they changed, their diet or whatever they were doing that caused their vital numbers to be out of range. So that was fairly well accepted. I would think that our small group, we have the disbursement between office and craft, if you will. The statistics would probably be quite similar to even a big utility. Typically, the craft folks feel like they're more busy and won't take the time off to go get the health physical, and sometimes they need it the most.
Well, basically, what I think we can do is establish a rigor similar to what you're describing and do those kinds of things. I just don't know what the legal framework of some of the things we're talking about are. I
Well,
mean,
the county has a program similar to that. And I don't know about the stipends, but it's pretty well mandated that county employees have a wellness check once a year. And then they go through a program. They've got the wellness center and a lot of their medications, a lot of common things can be done, through the wellness center. And
Right, when you have those, and if they're on site, for example, by a caregiver, they get some coaching then. And that's a good time to coach them on the mail order prescriptions if they have a maintenance prescription. And it helps them to really perhaps overcome some concern or some of the perceived complexities about getting the maintenance prescriptions filled that way. But that was very, very effective, and it improved the company's cost such that the increases to employees weren't like they were in the past. They were smaller over time. So employees become healthier, they show up for work more, they produce more.
yeah.
All of those benefits are very, very good, and it's a very small investment on the part of the company. So even with our small pool, I would venture to say it's beneficial.
yeah, now the county, you have your own basic wellness center, right?
Right.
And we don't have that, and so we have to kind of figure a way, if you have different primary care, because that's generally where that's given at, that we would do. The other thing we could do is look at maybe contracting for that
Yep.
with one place, so that we have somebody that could advise us as to how that's going.
Yep, I think that, all of that kind of stuff is outsourced. I'm sure you could direct us to some resources and a care provider that comes in here. And we have a health fair for 2 days or 3 days. We have times where the employees set up appointments and they're booked out, so the provider is here for that period, whatever it is, 6 hours or so. They are booked solid, and we get through all 150 employees.
Yeah, I've had plans in previous employers that did similar. They'd bring them in, there was 5 or 6 things they checked: cholesterol, blood pressure, BMI, whether you use tobacco or not. And then if you passed all 6 or 5 or 6 of them, then you just got the stipend. The way they did it was a monthly deduction on your premiums. So you get a little bit of a credit there. But if you didn't pass them, then you were required to go to a primary care physician and get counseling. It would be outside of normal working hours. You'd have to go on your own to get that done. But then you could still qualify for the monthly deduction.
When I go for my wellness visit, there's a whole range of labs that they do. More than what we said here, and we need to kind of figure out what are those labs that give us the best indicator that something needs to change. Person needs to be on cholesterol medicine, needs to be on blood pressure medicine, and things like that. And if we could have some help in that, I'm not saying I want to know what the employees
Right.
results are. But if we're gonna look at this as a way of doing it, we need to have an advisor that can say, this guy needs to, start doing some things.
Yeah, I would suggest that whoever the resource is, they already know statistically. We look at American citizens, what their demographics are, and they can probably pretty much put everybody in a slot as to what their average needs are based on their age, their weight, their race, et cetera. I mean, the facts are the facts. The DNA can't change much.
Yeah.
But for us to choose a program, my view would be that we move more and more aggressively with wellness approach. And we do the health check here, and hey, line everybody up. It's like going to the draft board. Everybody gets a shot. Same thing with the flu shots,
Right.
So we did that on premise. So a lot of times just doing a flu shot here costs pennies compared to what an doc in the box visit's going to cost you $220 just to go there for them to take your temperature and give you a flu shot or some prescription. That's going to cost you another $30 to $60 to get over the flu. So those kind of things will progressively drive our costs down remarkably. And if we prevent half a dozen employees from getting the flu, then we've added probably an average of 3 weeks of productivity for those each one. So, I mean, there's a lot of stuff we can do in that period of time production-wise.
So, Katina, if we do all these wellness checks and all this other stuff that we're doing, shouldn't a company give us a deduction on our premiums and so forth like that?
Sometimes they will, depending on what you put in place. Most of the time, it's just more of a couple of percent points just to say we appreciate your efforts. But really what it should do is the next year drive down cost and the next year.
Because you'll have that many claims and so forth
Yes,
like
sir.
that. Yeah, you're right. Okay.
So that's really where you're going to see the savings. I
Right.
mean, there's always that incentive to have our wellness plan put in place, and then we'll give you this amount off. And there is some of that, but the real savings is on the back end.
Savings to our employees as well. That's the
Yes.
main benefit.
Anytime there's savings here, there's savings to employees, yes.
Right.
Because when you look at, and that was one of the points and why we wanted to just show this when there are hundreds of pages to show, is just to kind of let you see where the dollars are coming from.
Right.
And frankly, that 269,000 may be only one or two people. So we're not fine, we only have 7 people based on this report meeting their deductibles. So that means that is probably only 1 or 2 people. Yes, and we have, with Joint Water, we've had the wellness people come in and do those diagnostic testing and then sent them on to a primary care. We've incentivized, we talked about this in our meeting, if you got this form signed from the doctor that you had your full wellness check with all your labs, you were put into a drawing for a TV and you got a PTO day for going to the doctor. So everybody likes a PTO day and everybody likes a big TV. So it could be just that simple and we can add to it. So we'll come back with some recommendations and research so you can make those decisions at renewal time, all of them.
Sure.
But all good ideas, because what you're really doing is no matter what the process is you use, all of a sudden the employees are starting to think about wellness. They're thinking about their health, they're hearing about their health, and they're realizing, okay, I was 30 and now it's an issue, but now I'm 40 and it's an issue, but I'm about to turn 50 and it's really, really an issue. And I'm not just talking about myself, I'm talking about your staff. And so everybody knows that they have to do something going forward. And so just talking about it is going to make all the difference. Okay.
Does United Healthcare is our provider now?
Yes, sir.
And do they have a wellness program?
They
within
do have a
that?
wellness program. Sometimes, depending on how robust their wellness programs are, it can kind of be a little smoke and mirrors. If it's just going to be a discussion assessment or an online assessment, a lot of insurance companies have gone to where everything is online. Your guys are out in the field. They're starting at 7 o'clock in the morning. They don't really have a computer sitting in front of them for them to stop and spend 30 or 45 minutes on a health assessment that's going to tell them, based on the first two questions you answered, which was height and weight, you need to lose weight. I mean, so we're looking for something a little more in depth, and we'll find out what they can offer and what they can add to. And then, as Commissioner Duncan said, there might be a cost associated with it. Well, when you see what it might offset in the future, it might be worth it, and we will look at all those for you. Yes, sir. So any questions on the benefit by type? Okay. All right, the next page is just the managed pharmacy. So all of the plans have their tier one, all three of the plans have their tier one drugs with, that are, the maintenance drugs for tier one are all going to have to be filled with a 90-day mail order or at CVS retail. So for employees who don't want to fill out the mail order information and get that separate prescription, they can actually go into a retail CVS and get a 90-day supply as if it was like mail order. So it makes it a lot easier and more accessible for people to get their maintenance medication. And it's 2.5 times the copay. So if it's a $10 copay, it's $25 for the 90-day supply. And the idea is sometimes what they find during their wellness visit is they have elevated blood pressure. It's the simplest thing to fix, but if you're not going to lose it, and they may decide not to take the medication. Maybe they just need to lose 10 pounds or stay off salt and sugar for a while. I mean, that doctor or that nurse practitioner can have that conversation, and it is a life changer, because that one small medication could make all the difference. And one of the things that Daphne and I have talked to the staff about each and every year are the local pharmacies and grocery stores that have $4 drug programs that are many times less expensive than even the insurance covers. So we really do try to get people to take those really low-cost maintenance medications. But this just gives you an idea of how many people are using them. And even though the home delivery shows a pretty low number, remember, if they're using CVS, that's going to fall into the retail side. So we really can't tell, based on this report, how many might be using maintenance medication, because, again, they might be getting it at the drugstore instead of through the mail, which is a bit more cumbersome. So just flipping back to page 1. And what we're going to do closer to renewal, as we have the more updated information, is we're going to scale this information back. Commissioner Elliott suggested on a couple of graphs that might just simply show where some of the money is being spent and the overall usage. And so we'll have that for you closer to time with those updated numbers. On page 2, now we talk about what it is that you want to see going into renewal and strategies that we can look at to maybe make sure that we keep a comprehensive plan, but at the same time, look at the cost structure while not letting the employees lose benefits, which is a little, we call a miracle. So, but there might be a way to do it. So the first thing that we look at is, we know it's the second biggest expense for joint water at 8%, so second only to salary. And that is the case in just about every organization because healthcare has become so expensive. So number 3, one of the things that you could consider, and we did discuss, was putting in a health reimbursement account. An HRA allows an employer to fund deductible reimbursements on the second half of a deductible. So one of the things some employers like to do, you talked about, maybe we want to put money into an HSA account for employees, but that means it's theirs. So if you put $500 a year into their HSA account, if they quit tomorrow, they take the $500 with them, it is theirs. However, and you have to put 500 in for everybody that chooses an HSA, so that goes to your bottom line. If you use an HRA, you could choose a $2,500 deductible or a $5,000 deductible, and after they meet $2,500, you pay the $2,500. So the only time that the commission would spend any money is if the employee first met the deductible benchmark themselves. But then you buy and pay for a $5,000 deductible, which is lower in cost, but essentially the employee has a $2,500 deductible. Does that all make sense? Oh, good. Okay.
On the current HSA that we offer, the deductible is 5,000 for an individual
Yes.
and then 10,000 for family. That's all in
Correct.
network. That's-
In network.
Okay, then what counts against the out-of-pocket for the individual in the network?
So in the the out-of-pocket on a 100% plan is kind of confusing because you think if you have a 100% plan, there should be nothing after the deductible. But one of the things that the insurance companies have done when they are creating their contract is they will add additional copays and deductibles on certain things that may be inpatient, outpatient, certain types of testing that are additional copays, and they all collectively go towards that out-of-pocket. If you remember years ago, before the Affordable Care Act was passed, copays never went to the out-of-pocket. They just didn't go anywhere. So even if your out-of-pocket was $5,000 and you met it for the year, and you still had copays for drugs and going to the doctor, and it never ended. Now they all go towards the out-of-pocket. Then the out-of-pocket has gone up, and the insurance companies have said, well, how do we make this a little lower cost so it looks a little more attractive? And they added additional copays per occurrence for things like being in the hospital, having outpatient surgery, and all of those things are detailed and go towards that out-of-pocket.
Now, with the HSA he was talking about, once you hit the 5,000 that you pay out of pocket to start with, you don't pay anything else for that.
You do. You pay another $1,500 in copays on the drugs, and once
On
your
drugs,
drugs.
okay, I was thinking
Yes, sir.
medical.
Only on drugs?
Only on the drugs. There may be some additional, if you'll look. There are? Okay. Just hand it to me. Okay. So you have a couple things that United Healthcare has is they have their super preferred and preferred, both in network. So if you're a super preferred, then you're not going to pay any copay. If you're just preferred, you'd have a $500 per occurrence in deductible per service on the HSA for outpatient surgery and outpatient diagnostic services. So there are additional copays, but once you meet the out-of-pocket number, you don't spend any more. No more copays, no more deductibles. And I have the full benefit summaries if you want to review those as well.
Okay.
So moving on to just looking at if we had these in place currently, let's just say that our only option was to stick with the 3 plans we had, what would that look like just as an example? So we have the $1,500 and we're looking at number 3 and the indented 1A. The $1,500 deductible, it's such a low deductible, I don't even know that I would reimburse anything for that deductible. The idea is we really want employees to move away from those lower deductibles and look at something that might be more cost efficient. So on the $1,500, you might not reimburse anything. On the $3,500, you may choose to reimburse, say, $1,000 after the first $2,500 has been met. On the HSA plan, you may choose to make some sort of contribution, but we do have to keep in mind that in 2020, the health reimbursement account rules do change, and so we're researching how that works with an HSA, because the IRS does have some rules on how much you can reimburse for a deductible on an HSA plan, so we'll find out what those limitations are. And then let's just say that we decided to do away with one of the plans or replace them with a $5,000 or $6,000 deductible that had office visit copays and a drug card. That way, it looks and walks just like a really rich plan, but you're paying for a $5,000 or $6,000 deductible. And then maybe if you had the $6,000 deductible, the employees responsible for the first 3,000 and the commission pays the other 3,000. And that's where Andrew will crunch those numbers and come up with what that maximum exposure might be, because you always have to think, what if everyone on this group met their deductible and we had to reimburse them $3,000? Knowing that statistically it's less than 10% that ever meet their deductible, and knowing that we'll have a deductible report showing how many, as close as possible, met that deductible, you will have more information to go on to make that decision. But you can imagine if we bought a plan that was maybe 10 or 15% less, but only had to pay that deductible reimbursement if it happened, and if that only ended up being 10% of the employees, you may only spend $15,000 or $20,000 in reimbursements, but you might have saved $50,000 or $60,000 overall in premiums. So that's one of the strategies that we talked about that we will look at renewal. Andrew, do you have anything to add about what those numbers look like?
I can go through that now or after you get finished.
Okay.
I handed you a packet that says, it's about 8 pages, says summary of HRA costs. The first page is just that summary so that you can refer to that. But essentially what I looked at was if the people on the $3,500 plan went to the HSA, the assumption is that if you're on the $1,500 plan, you're probably going to want to stay on that because you're just terrified of anything with a high deductible. So those people, I assume, didn't change. But I took different percentages of the groups that went from the $3,500 to the HSA, and this is assuming that the reimbursement would be $2,500. The second $2,500 of the HSA and be one per employee. So if you're on a family plan, you can't get it for 4 or 5 people. It's just one chance per household. And then calculated what the max liability would be if every one of those individuals hit the deductible. This employer savings is a difference in what we would pay in the monthly premiums each month at the different percentages, and the liabilities if everyone hit it. So if only 10% of the people that are on the $3,500 plan decided to take the HSA option with the reimbursement, if every one of those individuals hit the deductible, then we would lose $1,400 for the year. That's if every one of them did that. If only, say, 10% of the 10% hit it, you would probably save about $35,000. So it would get increasingly higher than that. The scenario column on the left is the number of people from that middle tier plan that would go to the upper tier, and then what the savings would be on premiums, what our total liability would be if everyone decided to take us up on hitting the deductible that year, and then what that savings would be at max liability. So that would be a minimum savings at that percentage rate, and most likely it'd be substantially higher than that. And that's an annual number, not a monthly number. So if you look at the pages, you can they're all laid out if you wanted to see the nitty-gritty details, but the summary sheet kind of gives you the.
Well, I don't think you ever get 100%.
You're never going to get 100% to do it. I was just picking a bunch of random samples throughout that. And again, this is also assuming that none of those people on the $1,500 plan decided to change.
That's right.
True.
Yeah, but I guess, where I am, it appears that the health savings plan, if the employee and this organization managed it properly, would incentivize so that the employee sets up his own health savings account, and which he would fund, which he would keep. And since that's rolled over every year, and if he doesn't spend any money out of it, then he has that upon retirement. He uses retirement funds also.
Let me ask, I'm sorry.
Go ahead.
The question is to Andrew is, are this saving the max liability, this saving, you realize, this saving to the company or saving to the employee?
To the company.
Okay.
The employees would also see a reduction as well.
Well, if we saving this amount of money, why can't we use this savings to incentivize even more for people to be on the program?
We absolutely could do that. I just picked the halfway point as
Okay.
an example, but we could
Yeah.
move that number wherever we wanted to.
And you will have the option to move that number when you see what the real numbers are, to see what that difference is.
After a year.
Yes, sir.
Okay.
And you may want to use some of that money to incentivize wellness programs as
Yes.
well. So it's a win-win.
Right.
And we may find that the IRS limits how much we can reimburse on the HSA plan specifically, but as Commissioner Elliott just said, the employees can still open up their own HSA account, so we're not limiting them. And I think it's great that we continue to offer the HSA, even if we have low participation, because that's where it's moving eventually. But we might replace one of these other plans with a $5,000 or $6,000 deductible with copays, so the employees that still want that first dollar benefit are still moving in this same direction.
And per the example of using the $2,500 HRA, if 10% of our covered employees hit their deductible, that's 12 people. That's $60,000 that would be most likely the max that would be going out, because we very rarely are going to have more than 10% of our employees hit a deductible.
Right.
And the savings number doesn't change, so you can see that you could end up being over $300,000 if everybody did it, which naturally isn't going to happen, but even if half, you'd save $150,000.
And one of the things about the copay, although it doesn't feel this way when you've met your deductible already, these copays, one of the benefits of them is if I only have outpatient surgery, I only have to meet the copay and I don't have to meet my full deductible. So some people may have outpatient surgery and not meet their full deductible because they only had a $500 copay for that procedure at at whatever facility they had it in. So some of the copays actually cause a lower out-of-pocket depending on what the type of service that it is. So
And
it's just really hard to meet your deductible anymore. There are
And
just too many things that go the other
another
way.
thing that we discussed, now there's preliminary numbers, and we know at the end of the year it's going to increase a little bit, but our claims are substantially lower than what our premiums have been thus
Yes.
far this year. So, and theoretically, our insurance costs should decrease next year either way.
I think so.
If the claims
Assuming the insurance
between
people, you know,
August
do what's
and
right.
the end of the year are not any higher. But again, we'll know those numbers as well. So they won't be able to hide behind an increase they can't explain.
Yeah.
And we do have, and we'll have this available for you when we kill a few trees and bring you a big pack of paper. We'll have it, who went to the urgent care, who was seeing primary care, how many babies did we have, things like that. So we do have some micro information that might help just know where that usage is. And only a couple of babies, just a few.
Alan, if we're at a point to transition, or are you ready to go on? Because I have something I want to transition into.
Oh, okay.
Okay.
Is it still healthcare?
Oh, absolutely.
Okay.
In looking at the claims by expense, by size of payment, we have some really high numbers on some of the people. And I don't know how much of this is surgeries, and I think we need to look at how we can limit, such as people now go in and get knee replacements, hip replacements, and things like that, and how we can limit those kinds of costs. One of the things that I'm trying to research is using overseas facilities to do those kinds of repairs if they, the cost of the trip and the surgery is significantly less than what it is to do it local. And I don't know how you all would feel about that, you know.
Never really thought about it.
You know, if the facility principals are trained and certified under our laws and regulations stateside, I don't see there being an issue, really. I had an expat experience where I did some eye surgery a number of years ago, and the surgeon was trained in the States, and so I had enough other employees that recommended that individual, and so I was quite comfortable with it. And the results, how many years has it been? 18 years now, I think. It's pretty darn good. So in that regard, you know, there's just an opportunity for managing our costs down.
Yeah, that's kind of what we need to look at and get, and is that easily obtained?
So,
The cost of a potential surgery?
this is a conversation that a lot of people are having because obviously everything's on the table when you're talking about something that's costing as much as healthcare. A couple of things to keep in mind. One, United Healthcare has a standard network. Now it's nationwide. You can go to California, you can go to Wyoming, but you may not be able to go to Italy or Mexico. And so the insurance company may not pay for it at all. So now you're thinking about paying for it out of pocket, which there's no way that would save you any money. But the real concern is if I go and I have a knee replacement surgery done in another country and it's only $6,000 instead of $80,000, and I have complications, I'm in the States now. I can't go follow up with that doctor. And if there is such an issue, I might have a hard time finding somebody that's going to take my case. Fortunately, we have a community hospital that has to have someone on staff, so someone would have to take it. But there's a little bit of liability because if you push an employee to or encourage or entice someone to go in that direction and they die or they have to have their leg amputated due to infection because they had any lack of care, it just might be something to seek counsel on. We find a lot of groups are buying their medications on the larger self-funded groups, maybe from Canada where they're much less expensive, but because this is a much smaller group, that's something you all would have to decide internally, but I don't know that you would see the much savings at this time because it's just not regulated and the insurance may not cover it.
Okay, well, we kind of need from whoever quotes from us what the standards of care are and what they will and won't do.
Out of the country.
Out of the country or not local, meaning go to California. I don't think California is where we'd go, but you might go to.
It's not completely out of the country, yes. Yeah.
Well, it's
Although,
close.
yeah, okay. But yes, it is a nationwide network. So here's something too that United Healthcare has that might sort of meet in the middle. They have a tool where you can go online and actually search knee replacement surgery, and it will tell you how much it's going to cost you in each area. So the employees could absolutely do that. We could not say, we want you to go to Macon instead of go here. However, we could say, if you go to Macon, you will save this much money. But when an employee is seeing an out-of-pocket amount and it's going to be the same in Macon or in Brunswick, he's going to Brunswick. And it's not something that they're really going to see the savings on. The group as a whole will see the savings on the bottom line cost because they're going to meet that out of pocket no matter what. We barely have over a $6,000 out of pocket as it stands. And if I think, well, if I go to Macon, I could save $40,000. However, every time I have to see my doctor, I have to drive to Macon. That might be a concern. So, but we'll look into it and get back to you. Okay.
Well, this is pretty much just an opening look at what we're trying to do, what we need to look at. Other questions?
What I would like to do, Commissioners, is if y'all could provide some ideas that you would consider, and then we could get a few focus groups of employees together and kind of get their temperature prior to renewal, so that they have at least been heard prior to renewal instead of it, in their opinion, getting dropped on them without any say. We'd be happy to do that, but I don't want to go in there and say, what do you want from your health care? Because then we're going to be in a 7-hour discussion that's not going to be productive. So I'd like to go in there and say, you know, the commission's considering these 2 or 3 options. What are your initial thoughts? And just get their temperature on some of the changes and give you that information to help make decisions.
For me, Andrew, the biggest driver is more employee participation on the wellness side.
Right.
Is in some way we need to help the employees recognize the value of taking care of themselves. They're more productive, they're more healthy, they spend more time with their family. That's a big driver.
And maybe ask them if there was a wellness plan in place, would they participate?
Right.
And in what way would they participate? I know that we've had with other organizations that when the employer, and sometimes this happens, on large self-funded plans, a lot of information is very, very accessible. So the employer may be able to see that this person has a health condition or something like that. most wellness plans, that they will get statistical, a bar graph of how many, but not who.
Yes.
So that's another thing to kind of mention to them, that it would be private and it would be their information, because the idea is they're being given the tools to take care of themselves, not Big Brother looking over their shoulder to see who, any of
Yeah,
those
the
other things.
big drivers, I think, for us would be is if the employee is healthier, they can contribute better.
Yes.
That's the reality. And it doesn't matter whether they can contribute here at the utility or they're contributing at home, they're still a better contributor overall. And they'll go a few more years with that contribution.
I know
So-
Humana has a plan, I'm not sure exactly, where the employee can not only get credits and everything from wellness, it lowers the premium, so the company gets a credit back. And then that company can decide if they want to reimburse or give some of that credit back to the employee on a 6-month basis. And plus, they can get other things like watches and stuff like that.
Right.
That will help them so far as monitoring all that stuff by
Yes.
doing certain things.
And there are different companies that incentivize, that their incentives are different. So Humana, if Humana was a company that came back with a quote and we looked at them and said their incentives are great, one of the things that limits Humana, who I think is one of the best companies, they don't have Mayo Clinic in their network. So even if Humana was great, we don't want to lose Mayo Clinic because it's just such a staple for the employees. But one of the things that they do to try to overcome that, when they could just get in network with Mayo, is all of they probably are the best at incentives. And my office has used them before, and you get a Fitbit and a drink cup. I mean, it's really, they're constantly throwing something at you as an opportunity. So, but you can enrich those incentives as well. It doesn't have to be something that we pay somebody else to do. So this is a small enough group that you can tailor it just the way you want it. So there are canned plans. We can tweak a few things. We can make the copays different. There are certain things we have to have and certain things that we can move around. So all good ideas. Any others?
I guess we'll kind of table our discussion until later on in the month, and you're going to have your focus groups to see.
I'm gonna try to get
People do.
a couple of them scheduled prior to the end of the year, knowing that the renewal comes before y'all in January.
And then we'll have a series of meetings based on that.
Might ask them if they're interested in wearing a pedometer, just for grins.
Sure.
Yeah, that was one thing that was offered in a wellness program that I participated in a number of years ago. And it was eye-opening for me, because I didn't do a lot of walking at the time. It changed my behavior, you know.
We can all go to Samsung instead of Apple cell phones, because Samsung has the health app that takes your steps already.
But, you know, one of the things that we talked about, if we want, and again, this is a long game. So if we want to start by incentivizing employees, so let's say that they agreed to either set their app on their phone. Do you all offer cell phones, or do they just get?
Some employees do have cell phones if they're needed to be called during the day out in the field.
So they may have the
Right.
they may have the option of downloading that app. You may want to buy some of those and let it be voluntary, and anyone who you let it run for, say, a week, and then anyone who increases this amount over this period of time gets this. One thing they all love that doesn't really, it does cost money, but it doesn't cost money at the same time, maybe an additional PTO hours or time or some sort of incentive to do that very thing, because people get very competitive with those things. All of a sudden, they're only 200 steps away from the next goal of whatever it is, so they walk around the block, or they walk to McDonald's instead of drive-through, anything they want.
Yeah, it's usually the bragging rights are the more valuable. You know, when you get in that circle of folks that are having a little trash talk going on, then
That's right.
that's where it comes in valuable.
So you can do any of those things.
My wife started comparing mine and her steps, and I got home one day, she was making laps around the couch to make sure she beat me.
It's very, very competitive in a household. Do you want me back the 19th or the 18th?
I think we may not need that discussion at
Okay.
this time.
And is there any way that I could find out the results of the focus groups, just so
Sure.
I can, okay, good. Okay, thank you very much. I appreciate your time.
Commissioners, anyone else have anything else for the good of the order?
Yes, sir, I have one thing, if you don't mind. I notice, you mentioned that you didn't want to bring up the pension plan, in this, forum. However, I would just like to make a brief comment about it.
Okay. The reason why it wasn't in today was not that we weren't gonna do it.
I understand that.
Okay.
My comment was, seeing that I was the only lone person that really had some issues with the vesting part, and so after careful review and looked at it, I think that probably be a better deal for our employees. It's gonna take some time for them to get used to it, for us to, especially with attrition and so forth, when people actually retire, whatever, but the people are buying in and so forth. So I really think that it'd be a good plan for us to do.
Okay, I'm not sure.
The plan where was recommended by Mr. Burrows.
Oh, okay.
The grandfathering in.
Yes,
Yes.
I think that'd be really good. I took a look at it. I really thought that this company is really doing well. This company pays its employees well too. So if we're gonna be the Cadillac, we need to be the Cadillac and stop being, trying to nickel and dime our employees. We got great employees, and we should treat them as such. So, and I think that would be something that would be a good incentive for people to continue on with this company. So,
Okay.
after careful review and looked at it really, and going forward, and thinking about the future of the organization versus what we have right now, it'd be best if we go with the plan that Mr. Burrows presented to us.
Okay.
Just want to let you know that.
Thank you very much.
So you're welcome.
Thank you for that, sir.
Okay, with that, the meeting is adjourned.